If a disease is preventable, treatable, and yet it still destroys millions of lives, then the major problem becomes ignorance and not the disease. Nigeria carries a ridiculously high number of neglected tropical diseases, illnesses linked to poverty, poor sanitation, unsafe water, and limited health information. Nigeria accounts for 1/4 of all neglected tropical disease cases across Africa. Let me break them down for you. Start with river blindness. These black flies that breed near rivers and fast-flowing streams, repeated bites from them cause river blindness. Symptoms include severe itching, skin rashes, thickened skin, eye pain, blurred vision, and from its name, it can eventually lead to blindness. We have 33 million Nigerians affected. So apparently mosquitoes spread more than just malaria, because elephantiasis is spread through the bite of a mosquito carrying parasitic worms. Symptoms include severe swelling of legs, arms, breasts, genitals, pain, and long-term disability. Over 120 million Nigerians are at risk. Schistosomiasis, bilharzia. Now this is spread through contact with infected freshwater, rivers, lakes, dams, when swimming, when bathing, when washing. And the major symptom is blood in urine or stool, but tiredness, stomach pain, and poor growth in children are also other symptoms to look out for. Anyone using contaminated water can be infected, but we have over 20.8 million Nigerians who regularly have fresh water in their routines and hence are automatically at risk. Soil transmitted worms. Any guesses on how it spread? All of you that used to do short puts. Wake up today, find a bush, shit in it, minus the people that unfortunately do not have access to toilets. They're the reasons why this disease exists in the first place. Yeah. It really just spreads through contact with soil that has been contaminated by feces. Open defecation, poor sanitation, walking barefoot. As I know, gree do toilet for us. At least wear your slippers. Symptoms include stomach pain, diarrhea, poor concentration, weakness, anemia. And we have a whopping 29.4 million Nigerians at risk. Trachoma spreads through flies, dirty hands, poor facial hygiene, sharing of clothes. Someone says they are not sharing clothes with you now, or that you should not touch their baby. You say that they are proud. Symptoms include red, painful eyes, swollen eyelids, discharge, and repeated infections can cause blindness. Almost 6 million Nigerians are at risk of this too. Now, it's not that these diseases don't have treatment, but a lot of people don't even know how these infections occur. Early symptoms are ignored, or people blame their symptoms on their village people. So then you go to your babalawo instead of going to the hospital for treatment. Then you don't get better because waiting concern your village people concern red. And most importantly, the information just does not reach the people who need it the most. Those that are really at risk. This is what low health literacy looks like. Neglected diseases thrive where health literacy is low. When people understand symptoms, transmission, and treatment, these diseases lose their power. Elimination begins with knowledge, and knowledge must reach those most affected. And because at TPAWI we are committed to improving health literacy, we are not stopping our awareness online. We are hitting the streets this February. We're sharing flyers and speaking directly to families and communities about basic hygiene practices, safe water use, hand washing, sanitation, environmental cleanliness. These simple actions prevent the spread of neglected tropical diseases before they even start. Elimination begins with prevention. Prevention begins with knowledge. Knowledge must hit the streets.